Hello, everybody. I'm Dr. Matt Dietz, and I just wanted to share my story with you. How I became a chiropractor, why I do what I do, why I practice the way I practice, and why I live the way I live. I've always had a passion to help people, try and make a difference. Health has always been something of a passion of mine. I was a lifeguard when I was in high school, all the way through, always doing things like that. I ended up going to college, where I wasn't sure if I wanted to be a nurse or I was looking at even to med tech, and I ended up going the med tech route. So I was going to work in the lab, in the hospital, and started my senior year was a 12-month internship in the hospital, working in the hospital. And I realized after 2 months of this 12-month internship, this was not the place for me. I wasn't able to impact people's lives the way I wanted to, the way I was meant to. Living, essentially working in the basement, and one time you see the light of day in a patient's room, when I had to go up and stick them with a needle and take their blood. And I see people at their worst, and I wasn't able to make a difference in their lives. Multiple stories where someone just all they needed was a little bit more oxygen. The nurse knew it, I knew it, everybody else knew it, but I had to stick them, take their blood gases, go back down. But the machine's broken, takes a while. The whole time this patient was suffering, and there's nothing I could do about it until the doctor authorized the change in there. And in the meantime, the patient had to sit and suffer. Just because of the protocols, which there's a time and place for. But I realized I wasn't making the difference in people's lives the way I wanted to, and I decided to change my major. Started my senior year in college. I didn't know what I wanted to do, biology and chemistry, either work in the hospital, work in health, or work in industry in a lab someplace. And for some reason, by the grace of God, I ended up deciding to shadow a chiropractor. I'd never been to a chiropractor before in my life, but I had a lot of the prerequisites already to go to chiropractic school. So there was a chiropractor just a couple blocks away from where I was living. I called him up, asked if I could come shadow him, and I did. And it changed my life. I essentially saw people hobbling in but skipping out because they were feeling so much better. I saw the doctor, and he enjoyed life. He enjoyed what he did. It wasn't work. And I love the idea of being a doctor, being able to influence people's lives. And next thing I know, I changed my major and I applied to Palmer, and I was going to go into chiropractic school. Went to chiropractic school, went through that. A lot of ups and downs, and because it's tough, it's a lot of school, but it's all worthwhile. Looking back, I don't regret a single thing with it. It wasn't maybe the route I would have chosen to go or where I thought I was going to go, but definitely I'm glad I have. After that, I went. Ended up practicing in Chicago for 5.5 years with some awesome partners to lead me to the group that I prefer to practice in right now and how I practice. I at first worked for a couple docs here in the Cedar Rapids area, and I learned a lot of how I really wanted to practice, and what I didn't want to do and what I did want to do. But once I got to Chicago, I had an awesome practice out there. I've always been an athlete, got a chance to work. When I shadowed that chiropractor that first time, I had my very first adjustment. And I walked out of there, I felt like I was 6 inches taller. I felt better. And I was, like I said, I was an athlete. I was running track and cross country, and I noticed instantly my times dropped. So my performance improved. And so I had thought, hey, if I can help people feel better and I can help them have better results like this, why wouldn't I want to do this? So that's why I ended up going to chiropractic school. I went to chiropractic school only being adjusted one time, which is totally not the norm. Most students at chiropractic school have like 30 family members that are chiropractors, or they have a miracle story. They had asthma and were getting adjusted, and their asthma went away. Their body was able to heal. Lots of different stories like that. But that wasn't my story. So I was unique going into chiropractic school with that. But back to Chicago, got to be out there. I get to work with a lot of elite athletes, professional athletes, AVP Pro Beach Volleyball, Chicago Fire MLS soccer team, a lot of minor league soccer and football teams. Got to work with a couple of professional football players, and had an awesome career out there. But my wife and I, we had our daughter, and we decided it was time to move back home closer to our families. We moved back here to Cedar Rapids, Iowa. And it was the right move for us. There's definitely things we miss about Chicago, but things we don't miss too. But it's been great. And since being here, I've been able to work with the USA Wrestling and Iowa Wrestling programs. I've been able to travel to multiple Olympics, the London Olympics, the Rio Olympics, as a chiropractor taking care of athletes. I've been able to go to the World Championships in Budapest. I've been able to travel and do all these amazing things. And I get to, my real passion is working with and seeing whole families' lives transformed, because it's an amazing thing, and it's awesome to help someone win a gold medal, to be part of that, to help you made that bit of difference in their performance. But the even more important, when you see whole families' lives transformed, when you see someone reversing cancer, when you see someone reversing diabetes, whole families getting off their medications because their bodies are healthy again, that's what I really love, and that's where my passion comes from, because I get to see those things on a regular basis here in my office, and that's what drives me every day. I get to make this kind of impact in people's lives, and especially I do training on myself. I get coaching myself to help me constantly improve, to be a better husband, better father, better doctor. So I traveled to a camp, a training camp in Florida, and during this camp, they kind of break you down physically so that you break down mentally to get past your barriers, whatever's holding you back, because that's where most of our problems are, between our ears. And so in the Florida, in the middle of summer, doing burpees in the sand and running through orange groves, so you can kind of get the idea. By the end of it, physically exhausted, mentally exhausted, I go to get on the plane to go home. And just I know most of you probably had that, where you go to get on the plane, I just want to get home. I'm just done. And that's where I was. Now, I'm 6'1", and so when I get on a plane, my knee's essentially hitting the seat in front of me. And I lucked out, and I got in there's first class, and then they have that wall that divides first class and coach. Well, I was at first seat and coach. So I had a little bit extra legroom, didn't have a seat to hit my knee. Well, the plane takes off. Shortly after takeoff, the one behind me yanks my seat back. And like most of you, I turn around like, what the heck is going on? What's wrong? And she starts screaming for help. I ended up having to do CPR on this one for 50 minutes until we did an emergency landing in Lexington, Kentucky. Now, like I said, I've been a lifeguard, all this throughout my entire life. I never had to actually do CPR on someone until that moment. And believe me, it's life-changing. You've seen it on TV, but in real life, it's a whole nother story. This is your average 50-year-old woman, or in her 50s, overweight. She was traveling with her sister and her best friend, coming back on a trip from Florida. This is a packed 747 from Orlando to Chicago. And like I said, we ended up having to do an emergency landing in Lexington, Kentucky. But in the meantime, I'm doing CPR on this woman. Her sister and best friend had to stand there in the aisle watching me do this, the whole time. Like I said, we're towards the front of the plane, so the whole plane had to see it. But the worst thing is there was a little girl across the aisle, and she had to watch this happen. And mom and dad were trying to shield as much as they can, but there's just no place to go, no place to get away from this, and they had to watch this whole thing unfold. Once we landed in a small airport that didn't have a jetway big enough for this plane to deplane. So they had the roller bag thing, the thing they could load the bags onto the plane with. That's how the firefighters had come in, had to get on a backboard and try and get a 6-foot backboard out a 90-degree angle of a plane with a 200-plus pound woman. It's not pretty, and it didn't go very well, and everything you can imagine that went wrong did. But had to help her, the firefighters, and the sister and best friend off the plane, and then we had to take off. And this took its toll on me throughout the whole thing. And after I had a chance to get home, decompress, really evaluate this, is when it really hit me. Is if this woman would have known what my patients know, what I teach my patients, what I engage my patients in, this lifestyle every day, this wouldn't have happened. And so this is my purpose, my passion, to help save and change as many lives as I possibly can. And that's why I love what I get to do every day. I am blessed that I get the chance to make an impact on people's lives, to help them live the life that they were meant to live. So this is my story.